Good morning, everybody, and thank you very much to Petra and the other organisers and to everybody for the invitation to open this event. It's with absolute delight and some trepidation that I'm opening this event, and in doing so I was asked to really set the scene for a thought-provoking and I suppose evocative discussion that we want to have over the next couple of days. So I was very much asked to really make us rethink how we approach dietary advice, how we might think about the components for dietary advice and the importance of evidence in that approach, but trying to turn everything on its head a little bit and really to make us think a little bit differently. So let's go back to basics first. The primary goals, as everything we want to do, we spend our life's work trying to eliminate a micronutrient deficiency or other nutritional deficiencies in order that we minimize the risk of various diseases, including our non-communicative diseases. But we also need to make sure that any advice that we give is applicable, that it's available, it's affordable, and it's acceptable to the populations that we're considering. And whether that's in a developed country, a developing country, in a particular setting, or in a particular group of population group, patients, etc. We really need to make sure that actually the advice that we're giving is going to have the impact that we want it to have. And I'm going to challenge us to say, I don't know if we've been doing a very good job, a lot of this now. There's a lot of evidence to say that we've done very well, but there's also evidence to say that we can do a lot better. So we know there's a clear link between diet and health, and we have an awful lot of epidemiological RCTs, etc., that link nutrients to risk of particular diseases or food to a particular disease, and particularly some dietary patterns, whether it's Mediterranean diet or other types of dietary patterns. And there's a wealth of evidence in this. And this evidence is then used to provide dietary guidance in the context of individual advice or public health food-based dietary guidelines. And we all know that if we get it right, we can have a really positive effect. I'll give two very clear examples of iodine deficiency has significantly reduced with the auspice of sort of dietary intake supplementation or iodized salt. And these deficiencies, you can see, have successfully decreased over a number of decades, and this has been due to a number of specific campaigns in public health to do so. The same could be seen with folate, although they're two micronutrient examples. The ones I showed you before were, again, instead of food and dietary patterns. But with folate and NTDs, we can see a very, very clear link between the increased circulation of either plasma or red cell folate and the reduced risk of NTD births. And such evidence really gives us very strong remit to include specific public health advice or individual advice for individuals. And we can say the same for many different nutrients, many different conditions, and the evidence base that we have within those. And I know we will hear an awful lot more about a lot of these over the course of the next few days. But there is an awful lot we're not getting right, and I think it's really important that as nutritionists that we do reflect on what we have done well, but also what we can do better. And that's really what I want to try and think a little bit about today, is to sort of say, okay, what have we got right, but how can we look at things differently? So what aren't we getting right? This is a nice paper that was recently published that really looks at the distribution or the prevalence of obesity, a global prevalence, and the difference between 1990 and 2022. And in the pink, you can see there that there's just an increase in obesity across all countries or many countries globally. If we look at diet-related disease, it's still one of the main killers in terms of if we could reduce the risk of NTDs, and this is across many different countries, across many different global regions. And then if we look as another lovely paper that looked at how much we have changed, and if we really look at the change in our diet, although we have had a plethora of lovely evidence telling us what we should be eating and how we should be eating, if we look at the change in, I suppose, the global dietary quality indexes from 1990 to 2018, we can see that very specifically, we've seen about a 2% change in healthy eating in that current period. And whilst it's a change, and some things have changed more positively than others, I would challenge that that probably isn't as good a job as we could be doing in making our nutrient intakes better, with all the evidence, the expertise, and the ambition that we have in groups such as those that are here in the room and online today. So if we look at the components of dietary advice, what we really need to be able to do is to understand the current status of an individual or a population. We need evidence to be able to say what we need to change, and within that evidence, I suppose we need consensus of that evidence, because whilst we do have evidence in a lot of the areas in nutrition, as was alluded to in the opening talks, there can be, I suppose, diversity in how that can be applied, or a little bit of controversy in the provision of that advice. And that does not help in respect to providing comprehensive advice either to the individual or the population. And we also need to show its efficacy, and we need to show its appropriateness, again, in the people to which that advice is being given to. So I challenge us now to say there are elements that are not working, so we have to look at things slightly differently. And what I'm going to look at today is some work that we've been doing in the area of meal patterns, personalised nutrition in the area of sustainability, and you can't give a Gibney a microphone and not let us talk a little bit about food processing, so I'll talk a little bit about it, but I know there are many who are going to talk about it over the next few days. So what do I mean by meal patterns? So this is an area I'm quite passionate about because it makes us look at the way that we can perhaps collect, analyse and consider dietary advice in both the way we collect and then also offer that advice. So this is work from a PhD student of mine, Cathal, who's recently graduated, who's spent a lot of time with me determining how can we look at meal patterns. So what do we mean by that? Meal patterns can mean different things to different people depending on the way we look at it. It could talk about the timing of meals. So whether we categorize a meal as breakfast in the morning or a snack in the midday alongside lunchtime or an evening meal. It can also then talk about meals in the context of what is eaten at those times. So what was eaten at breakfast, the foods that were combined to make that breakfast meal or your evening meal. So what were the foods and beverages that were done together? But we can also consider that then in the context. So was this a meal that was consumed in the office? Was it consumed at home? Was it consumed with others in a family environment? And I think it's really important that we begin to think of our diet in that context so that we can, when we begin to design our RCTs, when we begin to gather that evidence, that we allow the evidence that we then present to individuals to be taken up in a broad context. So moving away from the randomized control trials to this living environment in which we consume meals at different times of the day with different people in different contexts. But actually looking at meals is quite complicated. And some of the reason is that we gather our dietary intake data. We really look at our foods and our food groups intakes and we convert that to nutrient intakes. Now, we do use that then to offer dietary advice either at nutrient or food group intake. But in the middle of that, we do actually collect our meal data. So for those of you that have spent hours collecting 24-hour recalls, food diaries, we gather an awful lot of data and then we kind of skip by this bit here in the middle. We actually take the foods at an individual level, we code them, we calculate nutrient intakes, we use those nutrient intakes. And it's this missing middle that we have been working on a little bit. So our question was, can we begin to look at this in the area of assessing meal intakes to determine nutrient intakes? And then can we begin to kind of give a little bit of advice around our nutrient intakes to try and change meal intake advice? So I'm going to answer some of those questions in the next few slides. So just to give you a sense of the complexity of this issue and why we took the approach that we did. Again, for those of you that have spent time gathering information, you know that when we report foods, we code every single individual food that's in a meal. There's some lovely ones there, a burger, but we've broken it down into every component of that. But maybe, and we code it in such a different way. And if I was to look at that code and I could create a nice string, I would be able to create a singular string that is specific to that meal. But my husband doesn't like tomatoes, so his meal is different to mine, okay? If I begin to do that, I then have to remove a code and I suddenly have a completely different code, but actually it's still a burger. But in the analysis in which we do so and the way that we look at dietary intake currently, it is completely different. Okay, so then that's before I add chips. And again, my kids might like curly fries instead of straight fries. And does that constitute a different code? And the answer is yes. So we may have thousands and thousands of different codes. And we look at the combinations of those codes both within an existing meal, and then we have to look at the combinations of those across a meal. So if we begin to look at those, the complexity of those combinations is something that we tried to tackle, but realized that we would not be able to do much statistical analysis in that way. So what we have begun to look at, and we've spent some time working on, is really looking to strip that back, and can we consider this in more of a generic fashion? So really looking at reducing the complexity that we have taken to try and sort of say, actually, do you know what, a burger is a burger, and is that okay? Which might disturb some of the purists here, but I'm trying to throw a little bit of ideas out. I can see Alison nodding her head and shaking her head at me as I speak. So can we turn around and actually just say you had breakfast cereal and bread at breakfast? Can we simply say that you had meat and vegetables at lunch or at dinner? And is it impossible, or is it possible for us to actually utilize this approach to turn around and say we can get actually accurate information? So what we have done through a number of different studies, and one of the first studies we looked at is 2,500 individual foods, which created over 22,000 or up to 22,000 individual meals. But when we took the approach that I'll show you, what we were able to do is to simply break that down into 63 generic meals. And by generic meals, what I mean is this simple sandwich, meat sandwich, or a simple breakfast and toast, or a meat and vegetable dinner, or a meat and carbohydrate rice or pasta dinner. And we did this using a number of complicated steps that are outlined here. And what we were able to do is to, using various different types of clustering analysis, K means clustering, to determine different food groups. We then replaced each of the foods in each of the meals within this data set, and were able to create a series of meals that had, rather than the individual food within, replaced with the food group to which that meal was associated with. In doing that, what we then were able to do is to combine those meals together to determine a number of what we call meal patterns. And each of those patterns we were then able to align to kind of a number of different things. Okay, so how and what have we done this, and why have we done this? Well, what we then did is we actually took those meals that we have generated and we put them back into the data set that we have. And this was using initially data set from nutritional surveys within Ireland, but we've also applied this to a number of data sets, including N. Haynes. And what we showed is that by using these generic meals, we only saw a 5% difference in terms of the nutrient composition for the data set that we had. And when that was at a population level, and when we looked at an individual level, when we plotted people across those nutrients in terms of their previous things at either in exact or adjacent quartiles, we saw an 80% agreement between those two methods. So what we can demonstrate is that when we begin to look at meals meals and meal patterns, we are actually able to use this concept of generic meals rather than looking at the minutiae of the foods and the foods within each of those meals. When we took this into NHANES, we did very similar work. We clustered into the food groups. We then put these into the meals, and we then took those meals and clustered, separating for males and females, and found 42 meals for men and 41 for women. And then using those meals, using partitioning around the medioid clustering, we then created those clusters of those generic meals and created sort of different meal patterns for both men and for women. So why do I want to do that? Well, what I want to be able to do is to be able to determine, are those meal patterns different in their diet quality? And we could see some differences across those. Looking at an NRF score of the different meal patterns, we could see those of lower versus higher quality, but there was quite a distribution, sort of variance within the meal patterns across those. If we then took the meal patterns and we plotted those, both alongside the nutrient quality and the health outcomes, we could begin to see that there are some meal patterns, what we are able then to determine the nutrient content of, and then begin to link those to specific health parameters such as things like blood pressure, BMI, etc. Again, although there is significant variance within those, what it does is it challenges us to sort of say, actually, we are now able to look at these complexity of meals and the combinations of meals that individuals have and begin to sort of say, yes, we might be able to determine patterns of meals for an individual and link those specifically to health outcomes. So I suppose we've then sort of said, yeah, are meal takes useful? They can be, okay? So one of the areas then I wanted to look at is actually, could we begin to look at collecting dietary intake using meal-based information? So using the meals that we already presented or determined earlier in the earlier analysis, we conducted a trial in about 130 individuals where we provided an app that really presented pictures of the meals, and we simply said to our participants, what's the common meal that you ate yesterday? What's the generic meal that you ate yesterday? And we compared this then to a more detailed 24-hour recall, and we did this over a 2-week washout and reverse the combination of those and looked across the 2 time points. And what we demonstrated is very, very close correlation, or very close, and that between the 2 different methods, between the 24-hour recall and the meal-based, both at a macronutrient level, but also then at most of the micronutrient levels, there were some where there were differences that we need to look at a little bit further. But what we've clearly sort of shown here is that actually we can begin to think of this, and we can maybe collect at a dietary intake level and use that to determine an impact on health. And the question now remains, can we do dietary advice within this? And I hope Cosmos doesn't mind, but I know he's going to speak of this later, and we're working with him and his colleagues on this in the area of personalised sustainable nutrition, which I'll touch on a little bit later. So in doing so, I know he will talk of this a little bit later, but you can generate meal plans using such approaches of giving recommendations of combinations of meals over a given period. And Cosmos and his group have actually shown you can present with absolute accuracy the requirements for both macronutrients and most of the micronutrients, very much depending on the population that you are considering. So we'll look more about that. So I think we can really sort of see that I like to look at things slightly differently, and I'm going to continue looking at meal intakes. And I challenge us all to sort of say, is this a more useful way to provide dietary advice to individuals, and is this a way that we should be thinking about our diet? And one of the reasons is that we're always being asked to I suppose, develop healthy eating advice, and particularly now in the area of sustainable healthy eating. And one of the areas myself and my colleagues have been working on is very much in the area of personalised nutrition and sustainable healthy eating. And we've seen an awful lot of work in the area of personalised nutrition at an individual level, and I'll talk about a trial that we have completed in that area. But what I want to talk about is how we can begin to apply our personalised nutrition in a broader area. So trying to look at it in a systems approach, and we'll be applying this in a living lab that we have within University College Dublin. So let's just take a step back and ask, what is a sustainable diet? It means different things to different people, but essentially we want something that has low environmental impacts, that provides nutrition security and health and nutrients for everybody. It should be culturally accessible and acceptable, and it should be economically fair and affordable. The guidelines that are provided are varied, and summarising them here, if you really look at, we want to have regular and abundant grains, vegetables, fruit, etc. We want to reduce or avoid or consume less regularly things like red meat and processed meat, and see a more diverse protein intake. And we really want to diversify into increased plant-based proteins. And no matter what way you look at it, there's an abundance of different ways of looking at that, but that really are the three components that summarises a lot of those. So we've been challenged a lot within Ireland to sort of say, well, what do we need to change and how can we change it? And if we change it, how do we make that guidance effective? And if you look at the advice that we provide on a number of our shelves within our food-based dietary guidelines, we're doing pretty okay. The advice is there. The question is people don't follow it. So if we're then going to ask people to change further, to challenge them to sort of say, actually, you need to do more, because not only now do you need for population health, we need to help support planetary health. And one of the key shelves that is being targeted or needs to be considered is that of the protein shelf. And if we look within that, and the current recommendations are about 2 servings a day, choose different foods on different days, and it refers to different products that provide protein, refers to meat, fish, eggs and legumes, but I can tell you that the majority of individuals will focus on meat and fish, and we have a lack of diversity, as we do in many countries, in terms of our protein intake. So why is this a problem? Well, it's really something that's going to challenge us as we adapt the recommendations that are coming now, such as those that were originally proposed by the Eat Lancet report. And if we focus then back onto that shelf that I was speaking about, within the recommendations of energy within the Eat Lancet, about 75% of that protein energy is supposed to come from nuts and legumes. Now, I'm not going to go into the production end of that or how that can happen at a systems level. What I'm going to do is try and sort of talk to you a little bit about how are we going to adapt that to try and make it culturally acceptable for the existing populations that we have. And if we look at the Irish survey, 75 or nearly should come from energy, nuts and legumes. 63% of our protein is coming from meat, fish, eggs, cheese. This is a huge change if we're going to adopt this. And whilst we can have culturally interpretations and adaptations, that shift is going to be a remarkable shift if we're going to do it. So how are we going to give advice to do that? Well, we might not go as far as 75%, but what we have is we have conducted recently a randomised controlled trial that was funded by a number of different bodies within Ireland that sort of challenged us to sort of say, what are the healthy eating advice that should we be giving? What's the dietary advice we need to change to? And how are we going to be able to deliver that? And what we did is we recruited reasonably moderate to high meat consumers over a 12-week period. We assessed their dietary intake at various time points, their nutrient status and their health biomarkers. And these were randomized into 2 different groups, both receiving personalized nutrition. One of them was the personalized nutrition based on existing healthy eating guidelines following the current food pyramid, food-based dietary guidelines within Ireland. And the other following a much more sustainable diet. Now, there are a couple of nuances in here. What we wanted to do is to make sure that the advice that we were given was somewhat culturally acceptable. So we didn't move drastically to our nuts and legumes, but we did put restrictions on some of the meat intake, including messages like no more than 1 red intake per week, making sure that we increased our plant-based protein per day, increasing our servings of nuts. But what we try to do is to offer solutions to these individuals in that context and provide them with support in terms of recipes and other ways to increase legumes within those. It was incredibly successful. We saw a 40% reduction in greenhouse gas emissions in the intervention group compared to a 12% within the in the intervention compared to 12% within the controls. And this was achieved through the routes that we wish to do, with an increase in both fruit and vegetables, an increase in legumes, and a reduction in meat. We did not see any difference in health markers across that, and the current nutrient status is being currently analysed at this time. But what we did is we delved further into the challenges and barriers that individuals reported in the changes that they made within those. So we asked a number of different questions, and the one I'm presenting here today is sort of how easy and difficult was it to change. So if we looked at the red and processed meat, it was, relatively easy for them to change. It was easier in the intervention, a little bit easier intervention, and some of the controls said that they found it slightly more difficult to do so. And what we determined for each of the food groups and each of the areas was the enablers and the barriers for the individuals that had participated within this. For example, it was easy for them to remove meat from their diet, but they struggled to understand what to replace that with. So fruit and vegetables was quite easier, but legumes seemed to baffle many of our participants. So what we've done is we've taken those enablers and barriers and that have been reported, and looking at other elements within the literature. Within a large project, European project at Planet, we are looking at the university campus, as I suppose, a systems level. And what we have looked at is we have mapped the different enablers and barriers within that have been reported within our ongoing studies, but also those within the literature, within this actual ecosystem that we are working in. Excuse me. And we looked at both a macro, a meso, and a micro level. So, sorry, Patrick. So by macro, we mean those at a policy level, which in a university campus is very nice because we can influence the policy of, there we go, a policy of the provision of food, the cost of food, the availability of food. We looked at that at a meso level, working with retailers on campus to be able to sort of say, actually, can we influence the availability, the price, the provision of the foods that we wish to target in our current advice. And then at the micro level, we're able to apply the personalised advice algorithms that we have developed, and we will specifically focus those at the enablers and the barriers that are within that particular ecosystem. In doing this, what we're then able to sort of show is that if you join the dots, not just at that personal level, but you push the advice a little bit further and influence the environment, can we have a greater impact within those, and are we then able to then replicate that in other environments or push that forward? And that's what's being done, as I said, at this Planet study. This is a large European project that has taken this approach, I suppose, across 9 living labs. The living lab that we are focusing on is in Ireland, is in university students, and there are several others around Europe looking at older adults, younger children, families, etc., and incorporating all stakeholders across those to determine how can we make that change. And some of the work that we have been doing with one of our other PhD students is Patrick, is to then look at providing personalised advice, not just on the requirements that we have been looking at, so the needs that we traditionally look at, like our nutrient intakes, our phenotypic advice, but also their individual behavioural context. So what were the barriers that they actually reported? What were the enablers that they did? What are their specific habits that we wish to change? And what were the barriers to change for those? And if we layer those into our personalised advice that we can place within the Planet and the Living Lab context, we're hoping that we will be able to sort of show that that systems approach to personalised nutrition in the right environment can be as effective or more effective than we have seen at the general level. So I want to touch briefly, as I come towards the end, to begin to sort of say, as I said, you can't give a Gibney a stage and a microphone without talking a little bit about food processing. But yet again, I want to ask you to look at this and to challenge this in a slightly different way. Because as we've been working in the area of food systems and sustainability, food processing is sitting there, I suppose, as a little bit of a challenge to all of us. But it's not going to challenge us, it's going to challenge those who, I suppose, embrace food processing, but those that wish to push food processing away are going to be significantly challenged when we look at how we're going to have to embrace food processing within the context of sustainability and sustainable food systems. And unless we begin to look at this differently, we really are going to run into difficulty and issues in the provision of advice when we're looking at communities that really do not want to or are being advised not to consume processed food. So when we look at food processing at the moment, the majority of it does put it into specific categories. We can see them here, from your minimally or non-processed food up to your highly processed food, and they can be categorized in a number of different ways. The most typical one that individuals will know and the most commonly used is that of the NOVA food classification. And there's an abundance of evidence that can link those to specific dietary intakes to markers of health. One classic example I'm going to give here is that when it looked at multimorbidity and the consumption of ultra-processed food, as we look at the increase in ultra-processed food, comparing our lowest to the highest quartile, you can see an impact on risk of cancer, cardiovascular disease, type 2 diabetes, and combinations of multimorbidity. This paper did report with and without BMI adjustment. But why I like this paper, I suppose I could have used a multitude of these, and there are plenty that have been published. This paper also considered the foods not just at the total ultra-processed food intake, but the components that made up that ultra-processed food category. And it really showed that there are specific foods within this category that are driving this association, some that are showing a positive effect and those that are showing a negative. And those are, as we probably would have known from our evidence that has over the last 30 to 40 years, those animal-based proteins with saturated fat, those that are high in sugars and sweetened beverages, and then probably those that are high in salt with our sauces, spreads, condiments, etc. So I want to sort of say, actually, we need to begin to look at these differently. So the theme here, as you can tell, is rethink things. So again, I know we're having a session on processed food, but actually we need to begin to think of this slightly differently. So foods can be categorized into these specific categories. Now, each of these categories, depending on the classification system that you're using, is defined slightly differently. But what we looked at within UCD was to try and actually look at not just the classification, but go back to the food science and to look actually at the processes, not the classifications, and ask, could we begin to link those not just to health, because this is a very reductionist view, looking at a classification and looking at health, but actually link that to the challenges of planetary health, so looking at the impact with the environment. And then also, I know others, Adam has done some work looking at the link between that and affordability. So what I challenge everybody to do now is to try and pull our head out of the categorization a little bit and to look at that bigger picture, because if we do not address the impact of processing and our advice that we'll be giving for both population and planetary health, we're walking into a little bit of a quagmire that we need to address. So we have done some work where we again looked at a number of different meal plans. We categorized these into healthy, unhealthy, a healthy plant-based, and then a healthy plant-based but processed meal plan. And we looked at the environmental impact using a number of different, I suppose, kind of markers, cropland use, and the traditional sort of greenhouse gas emissions. We looked at processing in a number of different ways. We didn't really want to use the categorization, we did, but I'm going to focus on some of the other elements of that. What we looked at is the type of processing that was applied to those, whether it was canning, freezing, milling. And as a nutritionist, I've learned a lot about the different processes within food processing, and it's important that we are aware of these. So not just the type of processing, but the number of processes. But we also then tried to quantify that, and we looked at the energy that is associated with the processes across those. And we looked at the nutritional quality. And whilst this was a complex analysis, we sort of summarized this into a comparison of the different patterns across these. Whilst we can see there is, very significant differences in, I suppose, the nutrient quality and the density between those, particularly at the unhealthy one. The other ones are quite similar. We do see that there's an awful lot more processes that have been applied to the unhealthy diet. But we do see that actually the energy that is going to be required to produce the processed plant-based foods is actually something that stands out within those. So those processed plant-based foods, while may not be considered ultra-processed at the moment, actually will fall into that category. And if we're to begin to give advice, and the evidence that we can show from our personalised diets is that we need to make these foods available and in an acceptable format, we're going to have to address the fact that these are going to clash in terms of the advice. And I hope Adam doesn't mind, but I'm going to show a quick study that he has done also looking at, I suppose, the affordable nutrient density, again putting foods across a number of categories, not just food processing, but also looking at the nutrient quality and the affordability of those. And whilst there were a number of different messages within this, really what it showed is that affordable nutrient-rich foods will contain minimally processed and ultra-processed foods. And that is really important to remember, because if we go back to our dietary advice at the beginning, we really need to make sure that we show that we can provide something that is culturally acceptable, affordable, and appropriate for the audience. So I challenge everybody not to look at our categorization, and it's up to us to stand back, pull ourselves out of that little bucket, and to try and look at things slightly differently. So I hope I've given you a nice overview of how I look at things, and I hope I've set the scene so that we challenge ourselves to talk about things in a different way. We're going to have a lot of talks over the next while, and I've captured a number, or everybody whose picture was in the handbook, so I look forward to hearing from this crowd over the next few days. And I hope that by the end of this that we all might look at things slightly differently and really challenge ourselves for the future. So thank you.